Welcome to today's update. Bit of general news today. I want to start off with some fairly encouraging news from Australia. Warnings of a difficult winter to come in the United States, and it could turn out to be a problem in the United States. Trust in public bodies seems to be at an all-time low. India, the cases are increasing rapidly, and India is going to be the world's epicenter pretty soon. The cases are increasing dramatically, and soon there's going to be more cases in India than anywhere else. The cases are already increasing by a daily rate which exceeds the increasing cases anywhere else officially documented so far in the pandemic. And let's say there'll be some lunar thinking, some moon-orientated thinking from the UK, and we'll see what sense we can make of that. But diving into Australia first of all. Australia basically just coming up to date here with masks to be made compulsory. Shops, public transport, of course, as it should be. Schools in public areas, so outside the classroom in schools, masks are going to be mandated. Private events are going to be limited to 50 all over the country, outdoor to 100, but professionally it can be up to 1,500 or 3,000 outdoors. Now, let's look at the graphics we have for Australia. This is from the Australian website today. So total cases now up to 26,000. Deaths just under 800 in Australia. And it's good that the Australians put the recovered cases on there. Now these are patients in critical care. Victoria it's 17, New South Wales it's 6. These are patients in hospital. Queensland 10, New South Wales 15, Victoria 169. And we can also look at the cases by state on this map here. So obviously the most cases are down in Victoria. So these are the number of cases. In brackets we have the number of deaths. New South Wales a bit less, Queensland a bit less. Northern Territories, very few in Northern Territories and Central, which has been good. WA got off doing fairly well so far, getting off fairly lightly. South Australia also not too many, and of course the border between Victoria to the south and New South Wales to the north is essentially closed. So Victoria is essentially closed off at the moment. You can get special permits to go back and forth, but it's essentially closed off. Meaning that the outbreak in Australia has been very well compartmentalised. The Australian authorities are doing very well. And did I show you the graph of the trends in Australia? I don't think I did. So these are the trends in Australia. So basically we are seeing two waves. First wave here back in March, April. This wave here, mostly due to the cases in Victoria, but we see a very gratifying drop-off in those cases now, which is good. And we can also look at these figures here. This is as of the 10th of September. Now, 349 cases in the past 7 days. This is in Victoria, compared to 625 cases the week before in Victoria. So quite a gratifying drop-off there, really. The majority of recently diagnosed have been in the adult and young adult age group, indicating that a lot of the spread has been work-related, I believe, in Victoria, rather than socialisation. And the hospitalisation, this latest figure actually says 169 patients hospitalised, slightly different. 1 week ago it was 361 patients hospitalised, so again, good reduction in numbers. So reduction in cases, reduction in hospitalisations, and as a result there's a roadmap to reopening in Victoria, which is starting actually roundabout now. So fairly encouraging news really from Victoria. It's been isolated from the rest of the country and they are getting on top of things. Now let's just have a look at some of the official data from the United States. If we have the technology. Yep. So here's the overall position in the United States. And again, I've posted the link to this. Just go and check out your state. Wyoming's good, isn't it? Fewest cases there. But overall, cases in the States, 6.5 million. well over 190,000 deaths, over a quarter of a million cases in the past 7 days. And this also shows trends in the United States. If we can look at that, yep. So kind of first wave never really quite went away. Second wave, but official figures looking like they're going down quite nicely. And this is actually consistent with the hospitalisation data. So these are weekly hospitalisations in different age groups. And again, we see there was a pretty big wave there, pretty big spike there, flattened off, other spike, but also going down fairly encouragingly. But having said that, if you look at this site that shows the R value, we see there's still an awful lot of states where the R value, so Missouri there, the R value is technically 1. Florida is just above 1. West Virginia at a higher rate of increase. So still quite a lot of states with a positive R value. So, and well over a quarter of a million cases increase there we saw in the United States. So there's still a lot of cases, even though the general trend is good, there's still a lot of cases in the United States. Now, this was what I was talking about before. This is a Kaiser Family Institute report. Reduced confidence in the Centers for Disease Control, down 16% since April. This is not good. It's not good. If the population does not have confidence in its public health bodies, that's not good. And 62% worried about the safety of a vaccine. 62%. But we've had a reassurance that the vaccine is not going to be rushed. All the manufacturers have agreed to do that. And 54% of people in the United States in this survey have said they won't get vaccinated if the vaccine is approved before Tuesday, the 3rd of November. I think there might be something happening on Tuesday, the 3rd of November, but that was the time that people were not keen to get a vaccine before, if a vaccine was rolled out before the 3rd of November. So these two, this one of course here and this one of course here, tie up because things have become politicised, unfortunately. But I am reassured by the companies who have made this declaration that they're not going to rush the vaccine. Now, I'm reassured because they've made a public declaration, but I'm also reassured because they made a public declaration. If the vaccine did turn out to be dangerous, I strongly suspect they would be open to litigation. So that is one reason I am fairly confident this is not going to be rushed. And that means there is not going to be a vaccine before Tuesday, the 3rd of November. It is quite unimaginable that will happen. So I think these 54% of the population can rest easy that is not going to happen. Now, Dr. Fauci talking to Harvard Medical School saying we have to hunker down and get through this fall and winter. And we've been saying this on this channel for some time. The biggest challenge in this pandemic is going to be autumn and winter. Now, we're reassured by the remarkably low death rates in a lot of countries. We saw figures as low as 0.3 quoted for the UK, and the figures do seem to be going down. So the mortality we're hoping is going to be fairly low, but there's a possibility of many cases, and of course 0.3% of a large number is a lot more people than 0.3% of a small number. So it's this winter we're going to get through, and I am optimistic about the vaccines for next year. As I say, a vaccine before Tuesday, the 3rd of November, is not going to happen. It's not going to happen. Now, campuses in the UK, 50,000 in the US. US campuses. 50,000 students tested positive already. We've only been back for a week or so. Kept in isolation hotels, which are often not satisfactory. Now, students don't seem to be getting sent home. At least the epidemiologists don't want them sent home, and I guess unless they live close. But they have been isolated in isolation facilities, and often the infrastructure and the logistics has not been that good for supporting students in isolation. Because for a young person to be on their own for 10 or 14 days is really quite a hard thing. And some haven't even been supplied with food properly. I mean, I think that's being sorted out now, but there has been difficulties. But then again, of course, you're always going to get individual difficulties. But that's still an awful lot of students to test positive. So how does this bode for the term ahead? Not too encouraging for the term ahead. Does this mean a lot of young people are going to get sick? Hopefully not, because hopefully they're in the category that get some minimal complications from the illness. But the risk is always there. It hasn't gone away. So do click those links that we've just looked at. There's a dashboard there for the US, one on the hospitalizations and one on the R value. And I think that this sentiment is winning out in the United States. We looked at this yesterday or the day before. Francis Collins in National Institute of Health publicly declared science and science alone will be the way this decision is made about the vaccine. Otherwise, I will have no part in it. So Dr. Collins is not going to approve this until he is satisfied the science is good. And whether you agree with everything he says or not, he is a man of known integrity. So I trust that statement. Now, India. Let me just read an email from India here. In my city, Indore, in India, the situation is disastrous. In the last 2 weeks, I've at least heard from 80 to 100 known contacts like friends, cousins, friends of friends being infected with COVID. Just today, my neighbour who lives just 4 to 5 houses away died of COVID. Worst situation I have seen till now in my city. Of these, 7 people have died. I think death rate is much higher than the official numbers. Please everyone do take care. I am also trying to stay at home as much as possible. So that's an email from a concerned citizen in India. And going on to the data we have on India, it does look, well, certainly accelerating as we've said. Last 24 hours, 96,551 cases. 24 hours before that, 95,000 cases. These are the biggest increases we've ever seen in official figures anywhere in the world. 4.5 million people now infected in India. World's fastest growth rate. And deaths, last 24 hours, 1,200, just over. Just under 1,200 the day before, giving 76,271 deaths. Figures that have been over 1,000 for the past 10 days. Yeah, so over 1,000 for the past 10 days. Testing in India is looking pretty good, over 1 million tests per day. Concerning that there's spread to smaller towns and villages where the health infrastructure is often very poor, there's no doubt in my mind at all, unfortunately, that people will die through lack of simple healthcare interventions, as indeed they do, to be quite honest, at the best of times in India anyway, because the healthcare sector is remarkably challenged. Excellent private healthcare sector, government healthcare sector. I've been to some government hospitals in India, and it wouldn't be my first priority or my first choice to get treated there. But yet it's all that many poorer people have access to. All sorts of problems there in regards to access to healthcare in India. So Delhi, Pune, Mumbai and Chennai, worst hit cities, and spread to rural areas is the problem. And is going to result in a lot of there's going to be a lot of problems and more people to die, unfortunately. Now the UK, getting on to the UK, and that's the last country. We're going to look at UK in a little detail now. COVID tracing app is coming out on the 24th of September. Wow, it's only taken 9 months. Pilot highly effective when used alongside traditional contact tracing to identify contacts of those who've tested positive for coronavirus. So that's the report from the pilot study, which is good. Always good to hear positive results. If I can click the right one, there we are. Businesses including pubs, restaurants, hairdressers and cinemas need a QR code. So basically it's one of these, you know, these dotty codes with all the things, all of these squiggles on it all over the place. And you scan your phone into it, and these posters can be downloaded now by these establishments. So the idea is that you would have your phone, scan in, go into the venue. Then if there was an outbreak in the venue, you are on record of having attended that venue, which to me makes perfect sense, and it's only taken us 9 months to instigate that. Now, I haven't actually heard, I'm assuming that this British app is based on Apple and Google technology, but that actually wasn't in the report, so I assume that's the case. Now, NH Test and Trace, which is really a kingpin of what we need to do, that if someone tests positive, their contacts are traced and advised to isolate. Of course, this all depends on the contacts once they're being traced, once they've been contacted, once they've been traced and contacted, on them complying with that. It all depends on that. But even at that stage, we're not doing that well. So 32,000 odd close contacts with someone who had tested positive, where communication details were available. 79 were reached and asked to self-isolate. But taking all contacts into account, it was under 70%. Now, this is not, given that the numbers aren't too large here, these are not massive numbers for the whole country. To be quite honest, 70%, 69.2% of contacts overall is not good enough. For this to work, it needs to be at least 80%. Otherwise, they're still going to be spread from that missing 10% or so. So it's actually not working too well at the moment. And we are getting increasing cases in the UK. So this really needs sorted. This is basically now simple stuff. This is the basic public health stuff, the contacts that aren't being traced, and that really needs to get sorted out, because that is not brilliant by any means. Now, 9th of September, a couple of days ago, the Prime Minister's briefing, all a bit strange. Started off well enough, hands, face, space test, good if you need it. Universities not to send infected students home. Okay, so there's going to be a lot of isolated students need to be isolated somehow in and around universities. Logistical difficulties there, as we've seen the 50,000 people in the United States being isolated. Government want 500,000 tests a day by the end of October. The official numbers now of testing is, I think 350,000 is the official capacity, but most days we're struggling to reach 200,000. So testing difficulties still. And the difficulties in the administration and the logistics of the testing seems to be there in the UK. But the government want to bunk it up to 500,000, which is a laudable idea. That's good, I approve. Rule of 6 for 6 people, no more than 6 people meeting together, in or out. Now, to be fair, outside it could be more. But the thing about the rule of 6 is it's just easy to remember. You know, it's 6 people whether you're indoors or outdoors. And as well as that, if people are taking the mickey of the restrictions a bit, it gives the police unambiguous powers to break people up. Venues, while we're waiting for the contact tracing app to keep contacts for 21 days, which it should have been doing anyway. And then this really weird thing about the Prime Minister started talking about this moonshot thing. Basically, he seems to want to be testing everyone in the country once a week. It's like 10 million tests a day, which is just not possible. I don't know quite what his thinking is here, whether he was just thinking aloud. I think the British Prime Minister tends to think aloud sometimes, which is fine, but I'm not sure this is going to have any wings at all. But let's just see what was been said. So he's saying that so far we've identified people who are positive. We need to start identifying negatives as well. Then if we identify people who are negative, they can return to a normal life. is working on new types of scalable test, but it's turned out these are based on emerging technologies. In other words, technologies we simply don't have yet. We are not there yet. Now, if you had some sort of Star Trek sort of tricorder that went zzz, positive, negative, that would be great, but we haven't. At the moment, we do not have such a thing. So, are we in the realms of science fiction here? Perhaps a little bit, I think. It's based on saliva and swab tests, and it's supposed to come back in 90 to 20 minutes. But they're talking about using this test to get into venues such as football matches. So if you had to test everyone on the way into a football match and the result wasn't back for an hour, there'd be absolute chaos. I just don't see how that can possibly work with the existing technology that we have. But if people test negative, he's saying no measures would be required, therefore everything could return to normal. Isolated people released and everything, and there's a pilot study in Salford. Okay, there's a pilot study, let's see what happens. Testing people as they go into venues, but as I say, if it's taking 90 minutes for the test to come back and you've got 3,000 or 4,000 people waiting to test negative before they go into a venue, waiting out in the rain, I just don't see how this is going to work in practice. We've got the problems of test procurement, manufacture, distribution, quality control, all the logistics that goes with that. Anyway, he wants it rolled out by Christmas, widespread testing by 2021, testing up to 10 million people a day. You know, quite honestly, this is fantasy. I mean, I like to support the government where I can, but they really do need to rethink this. With the existing technology, this can't work. Government ministers agree that everything would need to come together. Yeah, I would think so too. A lot would need to come together, and I don't think it's capable of coming together. SAGE have correctly raised concerns. The cost is ludicrous. We just can't afford it. The country will be bankrupt. I mean, I think the overall budget for the NHS and everything and social care is 130 billion. So, I mean, these amounts of money are just ludicrous. It can't be done. Ministers just say the technology doesn't exist yet. That's right. I would say let's get the simple things done first. Now, you might have seen the interview I did with the German TV, the DW yesterday, where we did talk about this. And I tried to be as fair as I could. Actually, I've been thinking about this. What actually happened was a lot of the information we've got, virtually all the information I know about this, came from one article in the British Medical Journal yesterday, day before yesterday, can't remember. And the British Medical Journal got it from leaked papers between the British government, or the English government rather, and the Scottish government. So I'm just wondering if there's something going on, because the English government and the Scottish government don't always get on too well. There's political differences, so there could be something going on there that, of course, we'll never know. But leaving that aside, these mass testing could give rise to false positives. Now, the larger the scale of the test, the more false positives you're going to get. It would be at least 1%, and it'd probably be nearer about 3 or 4% of false positives. Now, if it's 1% false positives, and we're testing everyone in the country every week, that would be 660,000 false positives, plus their families, plus their households. So you're looking at about 2 million people isolating a week, purely on the grounds of false positives. This means that the scheme would lose all credibility. This is just a complete non-starter. It's just can't happen. False negatives could leave people with a false sense of security. So someone could be tested negative who was actually positive, think, oh, I'm negative, I'll just go out and live as normal. But they're actually positive and they would be spreading the virus because the test was a false negative. With current technology, it just can't work. If you could issue everyone in the country with a scan, it went beep beep, and you said, "Oh, yeah, today I'm negative," but that doesn't exist. There is no such technology. So, in the realms of science fiction, there, and one of the authors in the British Medical Journal said this scheme's probably not so much as a Neil Armstrong and an Apollo 11. As opposed to an Apollo 13, which you might remember if you're old enough didn't go too well. And even if you're young, you've probably seen the excellent film with Tom Hanks. Right, so please rethink, British government. That cannot work. It's a very strange idea and it won't work. Now, we've been looking at this idea of localised lockdowns in the UK. And this is working. And the next one looks like it's going to be Birmingham. Big city, 1.14 million. Cases 2 weeks ago to 1 week ago were 30. 7 days ago to yesterday, 892. Massive increase from 30 up to 892 cases. Cases up to 78.2 per 100,000. So it looks like regional restrictions are going to be placed in Birmingham there, consistent with this idea of rolling smart regional lockdowns. And just to finish off, on the same news conference about the flight of fantasy about the moonshot, Patrick Vallance, the scientific officer, rehearsed what we already knew. He says there's 200 vaccines around the world, 8 in phase 3 clinical trials. Good immune response in the elderly as well as the young. 6 vaccines already booked for the UK. We're hedging our bets on different ones. Manufacturers for some in the UK, although a lot are going to be manufactured in India. He said next year sometime. I'm not joking. This is what the chief scientific officer said at an official Downing Street briefing. A vaccine next year sometime. So I guess we now know as much as the chief scientific officer. And 500 medicines are being looked at globally, apparently. So where does that leave us? Well, we know about the increasing cases in Europe and the UK. There is a real risk of what we could call a significant second wave, and by that we mean a sustained increase in cases in the UK and in European countries. That is certainly possible. Dr. Fauci said the US needs to get over this winter, as indeed do we. And in India, the growth is absolutely massive. Let's just hope the infection fatality rate in India remains reasonably low. So interesting things over the next few months. To tell you the truth, I don't really know whether I'm optimistic or worried about the next few months. I think I'm optimistic because it's looking like the death rate is much, much lower than we thought. So I'm hoping that we're going to lose way fewer people than I had thought initially. But I do think quite a few people could become infected over the next few months. Right, thank you for watching as always. So boring talking to myself. It's much better if you stay.